I will live on our YouTube. Will live on our YouTube channel. In fact, maybe we'll drop our YouTube channel link here in just a moment. But for the time being, if I could have, yes, the what we do slide. This slide goes into a little bit more detail about what we do and who we are, and I encourage you to take a look. And as Danielle had mentioned before, this recording is now, or this meeting is now being recorded. And so if we could have somebody drop our YouTube channel link into the chat. And then, let's see, thank you, there it is. Thank you, Danielle. All of our trainings and all of our meetings are recorded, and that's where they live. So there's a ton of information there for service providers and community members. We encourage you to subscribe to that channel and just make sure that you're connected for all of those updates. We love to see faces. So if you're in a place where you're able to put your camera on and that feels appropriate today, we would love to see your face. You have the ability to change your name in the little Zoom box. So if you hover over your screen next to mute, you'll see those 3 dots. You can click on that and you can actually rename is the selection, and then you can change the information there. We want to know who you are, what your pronouns are, and how you are connected to the coalition and this work. If you are with the media today, we really just ask that you quote and pull from either coalition staff or our official presenters. And if there's someone else that you're hoping to connect with, please reach out to contact@homelessinfo.org, and we'll connect you with that agency for follow-up. So moving on, if I can ask somebody to put the link for our email sign up into the chat. Of course, all of you here may already have that because you're here, but we know that Zoom links also get shared, and we want you to be able to share them with folks. And so and we would also love to have direct access to folks who attend the meeting. So if you can, go ahead and click that email sign up if you are not already connected. And let's go ahead and move back to the agenda slide, please. Okay, so we are very excited. We've got a very full agenda today. First, we're welcoming Leanna Crescent from Poverty Action to go over changes to SNAP benefit eligibility, as we expect those changes to start on December 1st. We will also have some time for Q&A afterward. We will then hear from DESC as they are they're here today to share some information about the newly opened ORCA Center. We'll also have time for Q&A after that presentation. Following that, there has been a lot in the news, of course, and updates to the HUD Notice of Funding Opportunity, or the NOFO. There is still a lot in the air, a lot to be settled and learned in the coming weeks, but we will do our best to share with you the impacts, the implications, and update you on all the advocacy that you all and we have been engaged in around expanding the local city and county safety net to address the gaps created by these policies. We'll also take some time to update folks on election results before closing the meeting with time dedicated, as always, to community announcements. Some folks have reached out. If you have a community announcement that you'd like to share during our meetings, you can reach out and we can make sure we carve out some time for you. But it's also open space too. So time permitting, if you have an announcement that you'd like to share with the community, we will have time for that at the end. Okay, so now switching gears back, I would like to ask somebody to read out our mission, vision, and values. If anyone would like to volunteer, you can use the raise hand function, or you can just come off mute and start reading them. This is a long-standing tradition at the Coalition to read out the mission, vision, and values. Do we have a volunteer? I heard a voice. Oh, Justin,
yeah.
Yes.
Hi.
Thank you so much.
Yeah. So mission, we mobilize our community to challenge systemic causes of homelessness and advocate for our housing justice. Vision being a region that acts on a shared sense of responsibility to ensure that everyone has a home, and values being equity, justice, collective action.
Awesome. Thank you so much. Thank you so much, Justin.
You're very welcome.
We, like I mentioned, it's a longstanding tradition. We really, yeah, really try to, try to bring those words off of the paper and recognize that this is really the work that we all do and put into action. So let's go ahead and move forward with our agenda. Our first piece is going to be some announcements. We don't have a ton of announcements as we usually do, but we have an important one. Of course, it's the holiday season. We don't have a ton of events. We know people are very busy, but for those of you who are here at this November meeting, we really want to encourage you to come to our December meeting. It's our December legislative preview. So we're going to be really covering a lot of expectations, a lot of hopes for the coming legislative session. We have a number of elected officials as our guest speakers, Representative Macri, Representative Peterson, Representative Gregerson, other statewide advocacy partners. And we'll also get a chance to learn about our Advocacy Express bus to Housing and Homelessness Advocacy Day. That's going to be on Monday, January 26th. So you'll get more details about that. And of course, um, Housing and Homeless Advocacy Day is our big advocacy day. We would love to travel with many of you down to Olympia on our bus. So if that is something that can work for your calendar, we would love to go with you to Olympia. So, and that is pretty much it for our announcements right now. And I see the time now. We are right on schedule, maybe a minute or two early. I would like to welcome our first guest, Leanna Cresson from Statewide Poverty Action Network. Poverty Action advances equitable policy solutions for low-income people in Washington State through community organizing and policy advocacy. They develop and advocate for innovative public policy solutions that address the root cause of poverty, promote economic opportunity, and address systemic barriers faced by communities of color. And today we have Leanna because Poverty Action are amazing advocates who do incredible work to help maintain public benefits for people in need. And they do such amazing work to address systemic barriers that limit access to the communities that we all work for. So without further ado, Leanna, if you are ready, let me know if you need any help or support with your slides.
All right. Hello, everyone. I'm Leanna Cresson, she, her, from Poverty Action. Thank you for the lovely intro, Kevin. Yes, do you want to share them? You want me to share them?
I can share them. I just made you a co-host, but I have it up right
Ooh,
now. So let me
power.
go. Yeah, let's go. I can go ahead and share it right now. Just give
Okay,
me 1 second.
great.
A little while ago, PowerPoint started doing the whole presenter view, and it just makes things a little bit more confusing. So bear with me for a moment.
A little on the fritz, yes.
Okay,
Well,
actually give me 1 second. I don't think I'm sharing screen quite yet. Almost there. Thank you all for your patience. Does that look right for everyone?
yeah, that looks right.
Perfect.
Thank you, Kevin. All right, so as you may be aware in the news, this last month there was a lot happening with SNAP, and just a lot of uncertainty about public benefits in general. What's going to happen to Medicaid? What's going to happen to SNAP? All of these different things that were wrapped up in this bill that was passed. And so we wanted to take a minute, break some things down, talk through it, and just give some good grounding information, specifically around SNAP and the changes that we're expecting to come. Mhm. Perfect. So, like to start with some grounding. This is like a slew of bad news, so want to take a minute at the beginning to have a deep breath. We believe truly that poverty is solvable. We think that it is a policy choice and it can be solved. We know that this is difficult news and difficult changes, and we're not going anywhere. We're committed to advocating for what's right for the community. We also know that all this information isn't final. There's a lot of things up in the air that are moving and changing, but we're committed to giving the best information that we have at the time, knowing that things could move and shift. So yeah, just wanted to take a minute and start with that. Okay, so what is happening? This last month, I've felt like this guy with the red string. Between between the shutdown and the ongoing lawsuits and this big bill that was passed, a lot of different things have been impacting SNAP and when it's coming and is it coming and who's going to get it. So, if you've also been feeling like this guy, that's part of why. And we're gonna take we're gonna take a little bit and really. Focus on that HR1 piece and and tease out all of the different things that have been going so we can have some clear strings instead of this board happening now. Okay, so on the 4th of July, Trump signed the what he calls the big beautiful bill into place, and it does so many things. It's also called HR1, that's what we prefer to call it, but if you hear it called the One Big Beautiful Bill Act or OBA or HR1, the Republican mega bill, it's been referred to in a lot of different ways. So those are all this one big piece of legislation. Today we're going to call it HR1. So the bill has already been signed and enacted, and then the implementation dates go over the next 5 years. Big, wide-ranging impacts. A big sort of hallmark of this bill is it's designed to benefit wealthy Americans and strip safety net services for folks living in poverty. And another big part of it that I think is going to be impactful in the news is that it really frames poverty as an individual failure instead of a systemic one. And so there's a lot of focus on what people are doing wrong or a lot of like moral implications instead of understanding the systemic impacts, really shifting that blame. And it forces families to go without and states to do more with less. So that's sort of the context that we come to it with. Like I said, super widespread implications. It changes the tax code. It gives people with big amounts of money, big tax breaks. It cuts benefits. It does all these different things. The first changes that are going to hit folks are the SNAP changes. They're already starting to be implemented. And so we want to focus on that first because that's what's going to hit folks first. Okay, big picture takeaways. I'll also mention some of these slides. You might be like, "This is so many words on the slide, lady. What are you doing?" I wanted the slides to also be useful. We can send these out after the meeting so that you can have them, and then they can be a good like standalone reference as well. So, sorry that it's a lot to look at. I'll try to like go through it and explain it well, but wanted them to be a useful resource after the fact as well. Okay, big picture takeaways of what's happening. The first part is that states are going to be required to pay more for these services. Going to be the programs will be slightly worse, and it's going to cost the state more. Um, Also, individuals, people who are on these programs are going to have way higher burdens of proof, like more paperwork, more red tape. So much so that that amount of red tape and will create a high enough barrier that people will get kicked off of services because of the difficulty to access and maintain benefits and continually prove that you fit into these categories. Immigrants are also really targeted by this bill. So many immigrants will lose access to federal programs and have to turn to state-funded programs to meet their basic needs. Um, Also, this will have impact on our state budget because as this federal funding goes away, there's sort of this vacuum. And then at our state level, there will be this calculus of how do we fill those gaps? What do we cut at the state level to fill these federal holes? And so there's additional pressure put on the services that we have in our state to try to figure out like where are we going to take from to fill these holes? Um, Also, as more folks get kicked off of SNAP, as we got a kind of a preview of this in the last month, there's going to be more pressure on other services, food banks, social service agencies. The need doesn't go away just because services do. And so that pressure just ripples out into community, into partners. So that's kind of sort of the big picture takeaway. That's the snapshot of everything. I'm gonna get a little bit nerdy with you if you'll bear with me, and we're gonna talk about the mechanisms in the bill and how they're gonna do all of this and what it's gonna look like. So yeah, this was the bill again passed on the 4th of July, and here's the snap pieces. Okay. Whoa, so many words again. Here we go. So, work requirements are the first big part of SNAP. So, previously, this may be a big review for some of y'all, it might be new for some of y'all. I'm going to try to make it understandable. So, in Washington previously, um, there was only one county that had work requirements, and it was King County because it had a rate of unemployment. There was enough jobs that it made sense. Didn't make sense. There was enough jobs that they had work requirements there. All the other 38 counties were exempt. And it was only for a population called ABODs, able-bodied adults without dependents. And that was the only population that had work requirements. This bill really deeply expands where and who will have to do these work requirements starting on December 1st. Things that are staying are exemptions for disability. Washington is keeping the same definition of disability, so folks who were exempt from work requirements before will keep their disability exemption status moving forward. That's good news. There's also a 3-month grace period that will continue. You get 3 months for every 36 months. So every 3 years, you get a 3-month window where you can fall short of the work requirements and still receive your benefits. But after those 3 months, then there start to be penalties and you lose your benefits get cut. So that 3-month grace period is still in place. Those counties that were previously exempt, remember when it was just King County, they no longer are exempt. So all counties in Washington are now having to put in place these work requirements. So that could be a big lift for everyone and really confusing for all the CSOs that have never had to do that before too. The following groups have new work requirements. So again, this like big expansion that we're seeing. So seniors used to be exempt starting at 55. Now they won't be exempt until they're 65. So all those 61-year-olds out there who were previously exempt will need to start doing work requirements. The same thing is true for caregivers. So if you have a child, it used to be if they were above 18, then you weren't exempt anymore. But now it's starting at 14. So parents of teens will now have to do work requirements as well, starting when the kid is 14. Veterans, people experiencing homelessness, former foster youth, and Native adults not living on tribal lands were all previously categorically exempt. So you're like, if I fit under one of these things, then I am exempt from work requirements. But now that is no longer. So anyone who fits under those statuses will have to do work requirements unless they fit into one of the other things. So the people who are exempt are people with kids under 14 and people who are above 65 and people with disability status. And everyone else will have these new work requirements sort of coming in hot. A lot of people are going to be impacted by this. DSHS is estimating that about 1,037 people will be impacted by this, meaning that their status will somehow change. And they think that 57,000 people will lose their benefits, even though they're still eligible. We expect those work requirements are going to be about 20 hours a week. And as you can imagine, this is such a burden. First of all, for the people who are accessing SNAP, What a mess. But then also for the state who's administering this, who's having to, for the first time in most counties, figure out like, well, what are the work requirements and how do we meet them and how do we measure that and how do we take this time? And so it's going to take everyone across the board more time, more effort, more energy to add in this burden that won't be helpful. So that's terrible news, but now you know it. I see some questions in the chat. I have a slide about immigration status coming up, and that might answer your question. The way they define disability status, Denise, great question, is very convoluted. At the end, I'll have Patty, my partner in crime, Patty Bowen, is here, and she can help me go through that and define it. All right. In addition to work requirements, the benefits will also start stagnating. So previously, as the cost of living has gone up, so has SNAP benefits. And they calculate it using this thing called the Thrifty Food Plan. But part of the bill said that the Thrifty Food Plan can't cost any more than it costs now, which doesn't make sense because food will continue to cost more. And so over time, the value of SNAP will not be increasing the way that it has. Here we go. There's also more limited eligibility for immigrants. So there's a whole, let me start by saying that SNAP, the federal programs have never covered folks without documentation. So those folks have never been eligible for these programs. There's a lot of incorrect information given by the media talking about like who is accessing benefits and who this bill is intended to like target or cut off. It's largely incorrect because folks without status have never been able to access these programs, unfortunately. But that has never been the case. What this bill does is it targets certain more complicated statuses that are legal statuses in the states. I've listed them out here. So temporary protected status, applicants for LPR status, applicants for asylum, U visa holders, all kinds of different folks. Like these are all statuses that have previously been able to access federal benefits, and now are not. I'll take a minute to shout out Washington State and my guy Tony Lee. Something that we have in Washington is something called the State Food Assistance Program. So way back in the day, they created a look-alike program for folks who met all of the other SNAP requirements, but weren't able to because of their immigration status, namely that 5-year resident piece of it. Again, people who are not documented don't qualify for this, but folks with other immigration statuses do. So all of these folks who are getting kicked off of SNAP can seamlessly in Washington transfer over to FAP. Love that they're so similar, food access program. And that will be like sort of a seamless transition. The only thing that's different about it is it costs the state so many dollars. I'll get into this a little bit more, but SNAP is this sort of shared burden between the feds and the state as to who pays for it. State food assistance is 100% Washington state dollars. So DSHS had estimated at one point that if we just scooted everyone on the caseload over from SNAP to FAP who falls under these statuses, it's going to cost the state about $100 million extra every year. So it's good that it's there. Like we have the infrastructure. That's a really positive thing. It's not just, disarray, what are we going to do? It's just like, wow, that is a hefty price tag. So we're going to need some more money. The folks who can still access SNAP, the only carve-outs that they listed are citizens, green card holders, Cuban and Haitian entrants, and COFA migrants. So it's like a lot of the Pacific Islands will still be eligible. There used to be this program called Heat and Eat, if anyone's heard of it. Essentially, if you got LIHEAP, but but you didn't get, wait, if you got SNAP and LIHEAP, so if you got help with food and your utilities, then you were able to kind of maximize your SNAP dollars because they're like, well, if you qualify for both, we're going to maximize your SNAP dollars. They're not going to be doing that anymore. So if you need help with food and with utilities, that won't give you more SNAP than it used to before. There also used to be a great program called SNAP Ed that was eliminated at early last month. A lot of community organizations did a lot of great programming around like nutrition and using your SNAP budget and a lot of like really cool community programs around food and community that are no longer funded by the feds. This is another really big one. This is going to start in October 2026 for the first part, and then October 2027 for the next part. Big picture, like I was talking about that sort of cost sharing, the way that it has worked in the past is that the money to run SNAP was split 50-50 between the state and the feds. So like the people who work at the CSOs, like, oh, the technology behind the EBT cards, all of that was a 50-50 split with the feds. Starting in October of 2026, next year, instead of 50-50, it's going to be 75 in the state and 25 for the feds. That is going to increase anywhere between 66 to 81 million dollars a year, just the shift on the conservative end. The year after that, in 2027, right now, the way that it works is every dollar that gets to people's pockets, everything that's on an EBT card is a federal dollar. And that has always been the case. But in 2027, the plan is for a portion of that have to be state dollars. And the way that they're going to calculate it is based off of a state's error rate. So how many mistakes you've made in giving people benefits in the past. Has it been too much? Has it been too little? How many mistakes have you made? And this part can vary really widely depending on like what percentage of error rates that you have. So we expect to pay an additional $150 million a year. The highest rate, I think, is an additional $300 million a year. So it's very expensive. I'm not going to read through all of this. This is a summary of what we just talked about so that you have it for reference. If you like, make sure you get all these slides too. Okay, notes on medical coverage. I'll spare you the full rundown of all of the Medicaid things, but suffice it to say that a lot of the same changes that we see in SNAP are also sort of copy pasted over to the Medicaid side. Work requirements are coming, targeting people with different immigration statuses. All of these different things are also going to be put onto the Medicaid side of things, including the states having to pay more money. Those will start in October 2026. And the shutdown was about Obamacare coverage, the expansion of the Affordable Care Act, and they're fighting over that piece of it. So there's just like the yarn having to do with food, there's a similar thing happening with medical coverage that is also complicated. So all these things are sort of intermingled together. The next slide is the similar timeline slide, but for the Medicaid things. So we'll make sure that this gets to you as well. Okay, so what does this mean? How is this going to impact people? This is a lot of policy things. The first thing is, woof, there's a lot of uncertainty about SNAP and Medicaid. It's really impacting folks. Like, am I going to be covered? Will I have enough food? Like, does my immigration status qualify for me for this? What is going to happen to me and my family? That's the biggest thing that we're seeing is fear and uncertainty. That is already part of living in poverty, and it's just so magnified and exacerbated unnecessarily by this bill. Longer wait times. If you've tried to call DSHS recently, you may have been on hold for quite some time, 3 hours even. As you can imagine, with all of these different changes, a lot of people have questions. There's sort of a flood of uncertainty. What's happening? Are my benefits coming this month? Wait times are going to increase, and it's going to be the workload for the staff on their side. They're doing more with less, and so there's going to be less people to address those questions, which is really going to impact folks. Work requirements are starting December 1st, but aren't clear. That hasn't been a lot of good information coming out, all clear information about who is required to do them, what exactly that looks like, what counts as work hours. We're hoping to get more clear communications from the department soon, but it's November 20th. And so it's feeling really down to the line, and folks are nervous and scared. That could also mean that you have that 3 month grace period, which is great, but folks may burn through their grace period just waiting to know what they're supposed to be doing, which sucks. Um, and the other big thing are these ongoing false narratives and disrespect to folks who use these programs. Just from the headlines and the conjecture and like uh, even the notion of work requirements, asking people to prove that you're worth it and you have to work to get this. And so there's just the narrative isn't one based in trust and respect, which is what we hope to see is programs that are based out of support and not suspicion. But instead, the federal government is really doubling down on these negative, racist, sexist stereotypes about who accesses programs and who's worthy of them. And those narratives are getting further entrenched and deeper by the federal government. What are we doing about it? First, we're going to take another deep breath because that's a lot of heavy things. What are we doing about it? Okay, the first thing we're doing is we're giving grounded information. There's a lot of back and forth. We're trying to give as clear information as we can, updating it as soon as we know different, know better. We're also trying to connect community members with policymakers so that folks in positions of power can hear directly from the people most impacted, so that they can make changes in our state to hopefully shield us from whatever can be shielded from on the federal side. We're also going to keep advocating for the protection of the safety net. Like I said, these needs aren't going away because the resources are going away. And so we're going to keep advocating that people can have what they need to not just survive, but to thrive and live healthy and safe and joyful lives. If you want, always love to have an opportunity to take action. So we have a couple of QR codes. If you want, I can also drop some links in the chat. The first one is about asking the governor, who's going to be releasing his budget, to include the money that the state agencies have asked for to make the changes they need to make on the tech side, on the staffing side, to make sure that these wait times don't go crazy, to make sure that everyone can still access what they need to access on the tech side. So asking the governor to put more money in the budget. And the second one goes with it as well, is to increase and raise progressive revenue. So you heard me say a lot of big dollar amounts about the hundreds of millions of dollars. The Medicaid side is even more than the SNAP side. Billions with a B will be needed on the state side. And so we need to pass more progressive revenue. Washington State has a really, really upside down tax code, second most in the nation, so silver medal. That means the folks with the lowest incomes pay the highest percentage of their incomes in tax, where the people with the most pay the least as a percentage of their income. And so we have room to grow. There might be more slices taken out of the pie, but why not make the pie bigger is sort of our policy in a progressive way. So there's two options if you want to take action. Tell folks what you need to sort of shield from these impacts. Okay. If questions? Oh, wait, I need to pass it over to Patty. Patty, are you with us? Can you answer that question about disability status? I see you.
I can. Yeah. Sorry, I was having audio issues. So yes, you answered the question about asylum seekers. So it should be an automatic process where they go onto the state food program. That being said, we'll see how it goes when we get there, but everyone losing benefits due to the change in definitions and coverage should be automatically changed over. In terms of disability, I'm going to put the statute into the chat so that it exists there and you can reference it, but I'm also going to explain it because it's very word heavy. So there's the lovely chunk of text. Basically, there are three ways that you can be found to be disabled for purposes of SNAP. One is if you are already receiving temporary or permanent disability benefits. So if you're getting SSI, if you're getting ABD, things like that, where you already had to prove a high level of disability, the department will reference that and automatically check you as disabled. You don't have to apply supplementary documentation. The second way is if, and this, I'm going to say this with quotes because I would never use this language, if you are obviously mentally or physically unfit for employment. Obviously, that is very open for interpretation. And quite honestly, very narrowly interpreted by them. We've had people with traumatic brain injuries, with disabilities they've been born with, quadriplegics, and they've still said, yeah, but we're not sure. And so you're going, okay. Uh, Basically, we then fall back onto the second half of that, which says if it's not obvious to a provider, then you need a statement from a physician, and it says who is qualified as a physician to say either mentally or physically you're incapable of working. And that can be a actual physician, physician's assistant, a nurse practitioner, whoever's sharing their screen, just letting you know that we can see what you're doing. Uh, Licensed or certified psychologist, or any other medical personnel at the department. So it's a lot more broad than, say, proving disability for ABD, SSI, anything like that. And it can be a very succinct statement from, say, your psychologist that just says, their mental health is severely impacted to the point of being unable to work. Like it can be very brief, but it can also be open to interpretation. So you send in the documents, they will review them. If they need more information, they will reach back out to the provider. But those are kind of the three ways that you can determine disability. It's also important to note that just because a client has told the department that they're disabled in the past does not mean that they have marked them as disabled for purposes of SNAP benefits. If they lived outside of King County, they were already marked as being exempt due to the county exemption. So they haven't bothered going down the list of other exemptions and marking you as disabled. So basically, every single person outside of King County needs to be reevaluated for disability, and every person in King County who was otherwise exempt, so a veteran, homeless, foster child, etc., all of those exemptions that are disappearing also needs to call and be reevaluated as well. It's kind of like a funnel system where they're only going to ask you those disability questions if they can't put you into a different bucket. But now we're in a situation where all the other buckets are vanishing. So now we need to see all of the people that were in those buckets, should they be in this kind of one remaining bucket. So some other context as well.
Thank you, Patty, for that incredible information. On the screen right now, we do have contact information for benefits legal assistance through Solid Ground. We're also going to be sharing these slides out with everybody. So I'm going to go ahead and move us along. I am trying to be mindful of time. We've got a ton of great information here. Leanna, anything else about this final slide here?
No, just resources when you get the slides. Thank you so much for your time. I put my email in the chat. Feel free to reach out if you need anything.
Yes. Thank you. Thank you to both of you. And I know folks probably have, or they'll be thinking of questions, or questions will come up. So please make sure you have that contact info. And again, we will be sending out the slide deck afterwards. So yes, thank you so much, Leanna, and everybody. And that is it for the slideshow. I am going to be, I'm thinking of time, so I will just go ahead and quickly move us along in our agenda, although I know a lot of us are ruminating over the information we just received. So please hold on to those questions. I would love to introduce Kaylin Folkley. I hope I'm saying your name correctly, from DESC. They are here to talk about the new ORCA Center, which is the Opioid Recovery and Care Access Center. It's a key part of DESC's innovative response to the opioid crisis, and it's located inside the Downtown Behavioral Health Clinic. It's a safe space where people can recover after overdose, start treatment, and take the first steps towards stability with no judgment, no barriers, and support available 24/7. Kaylin, if you are on, I made you a co-host, so if you want to share your screen and uh, and and share your slideshow. Perfect. Welcome.
Thank you. Thanks so much for hosting, Kevin. And I saw Laura post in the chat some some transportation difficulties. I also take the Sea Line, and I had to duck out because to get Wi-Fi at a local coffee shop, because I didn't want to be doing this presentation on the bridge. So sorry. Hopefully you can hear the amazing soundtrack at this coffee shop. Anyways, I'm Kaylin Folkley, and I thank you so much for including me in this meeting, and I was so informative to hear about SNAP benefits before. So thank you so much for the education around that. And so hopefully folks will walk away with like a little bit of hope after this presentation, because that is definitely what's been leading the charge at the DSC the last few months, with the opening of our new downtown behavioral health clinic on the second floor of the Morrison building, which I'll talk about. And then a little sliver of that is the Opioid Recovery and Care Access, or ORCA Center. And so my name is Kaylin Folkley. I use she, her pronouns, and I'm an emergency medicine and addiction medicine physician by training. And I thought something that would just be helpful to start off with was kind of like all the things that kind of came together for the ORCA Center to open. And one thing actually was back in 2021, when the state versus the Blake decision came through our Washington State Supreme Court, which basically our Supreme Court struck down the law that said you did not have to knowingly know whether or not you had drugs in your possession in order to be charged with drug possession, which was just a little interesting tidbit of our law, because we were one of the only states where that was the case. So the Washington State Supreme Court struck down the law, and they struck down the law that actually meant that drug possession was decriminalized for a short period of time. During that time, there's actually a new, the legislature was in session. So there's a bill that was passed called Senate Bill 5476, which did a bunch of things to try to address this, striking down of this law. And one big piece of this legislation was to create a diversion in lieu of jail booking for drug possession. But an interesting component of this law is that it didn't really address any kind of medical interventions for patients or for folks, particularly those with substance use disorders, evidence-based treatments to be able to address the underlying conditions. So there are folks, especially at the University of Washington, who kind of opened up a conversation about like, how do we adapt evidence-based interventions from the clinical space, like a brick and mortar clinical space, and move that into the first responder system to kind of address the needs of folks out on the streets, and particularly in light of all this new legislation in this space. So some of the main actors here were Public Health Seattle King County. There was a group called the Research with Expert Advisors on Drug Use that had academically trained researchers at the University of Washington and community trained researchers, people with lived and living experience, were engaging in this work, doing qualitative work with key stakeholders in this space, emergency medical services, law enforcement, mobile crisis responders, mobile health teams, and people with lived and living experience themselves. And a lot of this work ended up focusing on overdose response and how that could be improved in our system. So there's this qualitative work that happened that ended up bundling into these work groups, strategic work groups, and strategic planning, in which some recommendations came about. And there's a long list of recommendations for how to improve, particularly emergency medical service response in the overdose space. But two things that kind of floated to the top. One was pre-hospital buprenorphine, and two, a 24/7 ED diversion center. Because it's pretty loud and clear that folks, particularly after overdose, that's like a critical moment for folks to be able to start and engage in treatment if that is what they're interested in, and at least be treated at a bare minimum compassionately in that space. And one way to do that is to give someone buprenorphine. And to kind of nerd out a little bit about how this medication buprenorphine works. If we imagine there are these receptors or cups in our body where fentanyl or other opioids can attach to. And fentanyl is a full opioid, meaning it completely fills up that cup. If fentanyl or other full opioids are taken in like a higher amount, that can actually overflow the cup, and that can cause an overdose, meaning respiratory depression, meaning trouble breathing, and sedation or sleepiness that could eventually lead to death. There are different medications to help address the underlying conditions of someone with opioid use disorder, meaning someone whose receptors or cups are used to having opioids or something filling it. One medication that is actually life-saving is buprenorphine. And the way buprenorphine works is it actually partially fills up that cup, meaning that it partially fills up the cup enough to help with withdrawal and cravings, but not enough to cause some of the negative side effects like respiratory depression and sedation and overdose. And what's really interesting is that buprenorphine, another component of buprenorphine, is that it's actually really potent, really strong, and not actually knock off other opioids that are binding to that receptor cup. So that makes it pretty tricky to actually get on this medication without causing any type of adverse symptoms like withdrawal symptoms. So we have to be a little tricky about how we can get help people get on this medication. And one critical moment in which kind of some of these complications are circumvented is after an overdose. So someone has those receptors or cups, the fentanyl or other full opioid agonist is kind of completely filled up the cup and actually overflowed it. Naloxone, Narcan, the antidote for an opioid overdose, can come in and actually knock off all those opioids off that receptor. It makes that receptor cup super open. And that's amazing. It helps people breathe again. It helps people survive their overdose. It's life-saving. But one con is that when the receptor cup is empty like that, people will experience significant withdrawal. They feel sick, nausea, vomiting, diarrhea, feel like they're about to jump out of their skin. They feel terrible. And one thing that could help treat that is actually buprenorphine. So we can give buprenorphine in that moment, partially fill out that cup, help people feel well immediately after this really scary event, and be able to make some decisions about what they want to do next, what next steps they can have. And what's pretty wild is that Narcan, that naloxone, can wear off in like 30 or 40 minutes, just about the time to transport that person to the emergency department, which makes it a huge bummer because when people make it to the emergency department and then Narcan is worn off, the time has passed for them to actually get that medication in their system. So it's really actually very time sensitive. And it's really cool that you're able to, that some people can actually deliver that medication in the field immediately after an overdose. And just to underline this, buprenorphine saves lives. It reduces mortality for patients with opioid use disorder by 50%. That's a number you need to treat of two. You treat two people, you potentially save one person's life. There's like not a medication that I prescribe that's like that. So that's one bucket. One other bucket is this 24/7 ED diversion center. And it was like, and I'm a former emergency physician. I used to work in the emergency department at Harborview. And I can tell you loud and clear from patients I encountered in the emergency department and folks who I encountered outside the emergency department that very few people, especially with lived and living experience of drug use, want to be there. Because the stigma and some of the other things that can happen in the emergency department, the trauma, the historical trauma that's experienced there. So that it was loud and clear that particularly after a traumatic event like an overdose, people wanted another space to be. So I'm really excited to tell you that both of those things are now happening in Seattle. And one is this pre-hospital buprenorphine system through some work that was happening at the city, a post-overdose response team was created within the Seattle Fire Department that was specifically there to address the needs of patients post-overdose. So they would come to the scene and try to provide trauma-informed care. But what became clear was that they didn't have that many tools in their toolkit to be able to help support patients after overdose. So they advocated for Seattle to become one of many large cities in the country to have paramedics or advanced life support providers, kind of like specialists of emergency medical services, the ones who can like intubate people, place IVs, and give medications, for them to be able to give buprenorphine in the field. So that started not this last February, but the February before. But what also became clear is that those providers, those like kind of specialty providers, were often not responding to overdoses because they were often going to other emergencies like cardiac arrests or strokes and heart attacks. So it became imperative for the system to actually be able to have firefighter EMTs, the basic life support providers, to be able to provide this medication, this life-saving medication. So they advocated for this to happen at locally, and the medical director went to the state and asked permission. And Seattle became the first, as far as I know, still the only city in the country where we can give buprenorphine out in the field, especially after overdose, which is pretty amazing and so cool. And just to give like a little bit of some background in Seattle, this is old data. So this is back in April 2025, but this is after we had treated 100 patients with buprenorphine. You can kind of see the heat map where these events were happening. But something I just want to draw your attention to is that the transportation. So you can see that most patients were still going to Harborview, but there were a huge chunk of people at that time, 22%, were not being transported to an emergency department. They're kind of being transported to an alternate destination. And we were trying to see that that was actually a safe and really effective way to treat patients. And then this is just a graph to show kind of the escalation of pre-hospital buprenorphine cases once the Health 99 team, that specialized team, the EMT basics, started to be able to give buprenorphine out in the field. So like the advanced life support providers did a great job. Often those cases were accompanied by the Health 99 team. Then all of a sudden, the Health 99 team got permission to give buprenorphine and things just exploded. But what became clear was that these patients don't necessarily need to go to an emergency department, especially after they get buprenorphine. They could go to another safe landing zone. And we were able to pilot this on one of the DESC locations called the Crisis Solution Center, and had some promising results. But there was a lot of work that was kind of happening in the background to create one of these alternate destinations. And that was the ORCA Center, the Opioid Recovery and Care Access Center. And that received some funding. The DSC received funding from the city and county and state to be able to fund the renovation of actually the second floor of our Morrison buildings, which is where the DSC started back in 1979 as a congregate shelter. So that floor was renovated. And now the services that were previously at a different location, including our behavioral health services, our drop-in, some of our case management services have now been moved into this beautiful space on the second floor of the Morrison building, co-located in permanent supportive housing. And a third of that footprint is the ORCA Center. And the ORCA Center it's really cool. It's really beautiful. And it's all shiny and new still. And I'm sorry, I don't have tons of pictures right now, but we're still waiting on kind of like the formal photographs to be taken. But now there are curtains and there are these 8 recliners that kind of fill this space. Oh, and we opened September 2nd. So everything's very new. So this is one photo of just some of the recliners, but just kind of like a high level view of like what we do. Like I mentioned before, it's co-located in permanent supportive housing and our downtown behavioral health clinic. We're open actually 24/7. So although the downtown clinic is closed or like open 9 to 5, Monday through Friday, our clinic, the ORCA Center, is open 24/7. The kind of 2 ways to get into the center, one is through overdose. So if a patient has experienced an overdose, they can come at any time. They just need a referral to get there. So referrals can come from emergency departments, emergency medical services, crisis responders. We have broadened out to particularly DSC housing as a way to get into us, but would love to kind of think through if you work in other spaces, especially kind of the 24/7 time frame of like how to get those folks to us safely. the kind of pathway for those referrals is just to call us. So the pathway is kind of similar to what would usually happen, like 911 would be called, EMS might respond, should respond. There would be kind of some basic evaluation to assess for medical stability, so some vital signs would be taken. We don't have a ton of exclusion things that would exclude someone from coming. Really, they would have to be able to take care of their basic needs, which is sometimes hard to identify after an overdose. And then not very pregnant, like someone who's imminently about to deliver probably shouldn't be coming to us. Otherwise, we would like to be able to troubleshoot to get anyone with us, especially if the alternative is to be on the street. Like, we feel like we're a safer place than the street, and so we would like to be able to try to help and serve those patients. The other kind of way that folks can get to us is actually walking in. So 9 a.m. to 11 p.m. every day of the week, every day of the year, someone can just walk in and ask for services. And really the types of services we're able to provide are medications for opioid use disorder. So we have sublingual, oral, and long-acting injectable buprenorphine. We also have methadone. So we're using the 72-hour rule, which is this kind of interesting piece of the legislation that, federal legislation that governs methadone dispensing for opioid use disorder, allows clinics like ours to be able to use methadone for 72 hours in order to help with withdrawal symptoms and or to get people engaged in treatment. So that we can use methadone kind of in an interesting way while we're trying to get people on buprenorphine, or alternatively, if someone's seeking methadone, like that's the medication that they would want to continue on, we can be a stopgap to start people and actually get them connected to methadone clinics in the area, particularly Evergreen Treatment Services, which has a provider here on Tuesdays and Fridays. So it's just very cool. So the basic pathway is someone has an overdose, they're deemed stable. They call a phone number, they press 1 for emergent referral. The phone rings, the cell phone of basically our church nurse. If they are busy and can't pick up, it goes to our provider phone. If they don't pick up, it goes to our clinic phone. So the idea is that you will quickly be able to talk to someone. You give a very brief report, and then hopefully there'll be like a clear pathway to transport that person here. If not, we can help try to troubleshoot that on the phone. And then just a shout out to these medications. They are life-saving, like I said, particularly buprenorphine and methadone. And something that I just want to harp on, and something that I'm really excited about, are these new long-acting injectable versions of buprenorphine. It's really cool. And again, I don't really want to nerd out on the dosing and how we get people on the medication. But before I joined the DESC team who works in this space has done some really cool work, really patient-centered work to create a new protocol to get people started on these medications using injectables. And just to share some data on this new protocol that was created. This was right when we started this protocol. There was an evaluation of the 95 people who initially expressed interest in starting. 79% of that population were experiencing homelessness or living in permanent supportive housing. Of the patients interested, 90% started the protocol, which is a 3-injection series. That means you have to come back to the clinic or outreach 3 times in order to get them medication. 90% initiated, 75% eventually completed the protocol, like all 3 injections, and then 64% received a second injection, which just compared to some of the other ways of getting on the medication at a similar time in a similar journal. There's actually a publication looking at a different method using oral medication, and that retention rate, which was just defined as getting a second prescription for the medication, was about 20%. So this is like a many-fold times higher rate of retention, and also on a patient population that has historically experienced a lot of social needs and trying to access care. So it's been a really exciting time to work in this space. Yeah, and so I want to be mindful of time, but just we're open. We've been open for about 10 weeks. We've served, I think, more than 500 unique patients, and we've had over 100 patients post-overdose come see us so far. And we would really love to partner with anyone on this call who feels like this might fit the needs of their agency. But Anyways, thank you so much for your time. And I'll look at the chat to see if there are things I didn't address. I'm sorry.
No, that's okay. I was going to say we do have one good question in the chat, and we do need to move along. But if you want to take a look, it's from Karina O'Malley. It's regarding advocacy and maybe some advocacy efforts outside of the city of Seattle to allow EMTs to administer this medication after Narcan.
100%. And the medical director of King County Medic One, because Seattle Medic One is actually separate from King County Medic One, is looking into that. But I think uh, it's complicated in the county because all these fire districts are kind of have their separate infrastructures. So any type of advocacy or desire to that you have locally, that would be amazing. I actually was in contact with the King County Medic One directors yesterday about just thinking through how do we get some of the areas around Seattle, particularly areas that are kind of MOUD or medications for opioid use disorder deserts. Like I'm thinking especially kind of like Burien, Federal Way, White Center areas. Like how can we get those folks to be able to receive care at the ORCA Center if that's something within their desires? So, but thank you for that question.
Yes, of course. And thank you, Kaylin, so much for joining us in our meeting today. I'm so sorry we're just moving along with our agenda, but please, for everyone, we are sending these slides out. And also we have contact information as well. So if you have other questions for Kaylin in the future, please don't hesitate to reach out. And also you can reach out to us and we can get you connected. So Kaylin, thank you again so much. For making this work. We have, even if you're at a coffee shop, we heard you loud and clear, and that worked out perfectly. Moving forward, I would love to introduce our Executive Director, Allison Eisinger, who is joining us on this call to cover a number of things, of course, budget updates and advocacy, but I'll let Allison take it away.
Thanks, Kevin, and good morning, everybody. I am joining you from New York City, and as Danielle and Kevin and some others know, I'm taking care of my family here. So I'm a little bit discombobulated, not only because of the time difference, but also because I told one of our wonderful partners, oh, there's Rachel. Wonderful. Great. Okay, so I'm going to just do a time check. Kevin, am I right that we have about 15 minutes for this portion of the agenda?
Yes.
Okay,
we can go
great.
15 minutes. Yes.
Thank you. Thank you so much. All right. Wonderful. Well, hello, everybody, and thank you so much for joining. Obviously, not only is there a lot of important information being shared, but there's a recognition that there is an awful lot of uncertainty. Lots of huge changes are coming to the SNAP program, and that's following the completely unnecessary and horribly disruptive and damaging cessation of SNAP benefits and the shutdown. And we are here to talk in part about some of the massive uncertainty that we're still going to be coping with in this community around federal funding for homes. But we're also going to talk about a really important thing for you all to remember. Advocacy works, you guys. And I'm so grateful that Rachel Alger from Seattle City Council member Alexis Mercedes Rink is here with us today. Rachel, I'm going to give people a little bit of context before I invite you to speak. But I just want to, I want to ground us, I guess, in where we are. Many of the folks on this call may already be aware of this, but we have lots of people in lots of different positions who come to coalition membership meetings. So please bear with me. And Danielle and Kevin and Megan, if you can help me keep an eye on the chat if folks have questions, please. Thanks. We in Seattle and King County are a continuum of care. And as a continuum of care, or COC, we every year apply for funding from the federal government from the Housing and Urban Development, or HUD, department which I would say has historically been the largest source of funding for housing, not only in our community, but in every community across the country. We do additional important things here with our state housing trust fund, with the City of Seattle housing levy, and through other ways of leveraging local resources and both public and private. But it's the federal government that has been the most significant and important source of funding for housing and services that go along with it through our HUD COC contracts until now. Now we are in the midst of the attempt to dismantle, destroy, and weaponize the federal government of these United States against the people of this country and the work that you all and we all do together. So what is happening is that whereas HUD was supposed to have a 2-year process, and the NOFO that everyone, including us, submitted an application for last year was supposed to cover last year and this year. Surprise, a number of months ago, HUD said, nope, we're doing a new competition this year. Okay, so then we all started hearing words, rumors, but in some cases very well informed rumors that indeed that was going to be a very disruptive process. And instead of renewing the funding, we use over 80% of our federal HUD dollars, over 80% of $67 million that we get in this community to provide housing for people. And permanent housing is what we have invested in, because that's what that program has been designed to help us and other communities do. So these dollars combined with city and county and state money and leveraging low-income housing tax credits and other sources, hundreds of millions of dollars are leveraged by these HUD dollars in our community. We provide homes and services for about 4,500 people in our community. And we need to renew that money. You can't just turn that money off and expect that people won't lose their homes. But indeed, what we started to hear from the National Alliance to End Homelessness and others is get ready, because their expectation was that HUD was going to do exactly what we have now seen that they are doing, which is they are limiting every continuum of care, including ours, to no more than 30% of their total award on housing. That means that nationally, 170,000 people, most of them previously homeless, are at risk of losing their homes. But also, it means that in this community and in others, it's entirely possible that even more damage than that could be done. So we started getting this information before HUD released its Notice of Funding Opportunity, or NOFO. And you all know, I think, because you are not new to the coalition, that what we do is we assess, we gather information, we talk with our allies locally at the state and at the federal level, and we spring into action. So a lot of you helped us put a lot of effort into educating our elected officials. And when Hallie, who's on a trip right now, and I walked in to meet with Rachel Alger, Councilmember Rink, and really the whole Councilmember Rink staff in City Hall, we were doing a circuit of meeting with every city and county council member to tell them what we knew and why we needed them to partner with us to create contingency funding, because there's no way to make up tens of millions of dollars later. We have to start now during the budget process. And it's Councilmember Alexis Mercedes Rink who heard and understood and started to work. So I'm thrilled to have Rachel here to explain to you all what that looked like at City Hall, and to give us a little bit of her perspective. And I will say, Rachel, I think this is the first time you're joining a coalition monthly membership meeting, but we always remind people with respect and with love, sometimes it's more important to talk to the staff than to whoever the elected official is. So please join me in welcoming Rachel Alger. who is going to share a little bit about the work that her council member did with others to get a really important start to our community's contingency fund. And then I'll come back and talk about King County and the rest of what we know. Thanks, Rachel. Welcome.
Well, thanks, Allison. That's a very kind introduction. And typically I've worked with a lot of elected officials over the years. And to your point about staff, I think that's typically right in most situations. But I will give credit to Councilmember Rink and coming in and truly understanding the issue at hand. I was even lamenting to my husband last night that I don't know what the situation could have looked like to not have someone with her subject expertise currently on the council, really showing that that matters. So the situation, as Allison described, is not good. I think all of us are pretty aware of that, and it's pretty disturbing. I was on a national call with the Alliance Ending Homelessness, and my kind of follow up after that call is it really feels like this change in the NOFO is designed to explicitly exclude jurisdictions like ours, whether that is trying to be intentionally cruel or they genuinely think this is the best way about trying to fix the system. I don't know, but either way, seems like it is very much designed to break it. So with that all said, we have spent the last couple of months, in particular the last couple of weeks, trying to figure out a way to backfill this before we even knew the outcome of what the NOFO was going to be. So right now there is $9.3 million in federal reserve in the city budget, and that was proposed by Mayor Harrell. And so that pocket of money is there. And then we did a proviso within the Human Services Department for $11.1 million to specifically go into this once we had the idea of what the outcome once we knew what the outcome of the NOFO is going to be. So that will be there. And there's also another $1 million that Councilmember Strauss introduced to the Federal Reserve. So that is a total of $21.4 million right now that the city has to address this issue. It's not going to close the entire gap. The county is working on things. I was just on a call this morning with State Representative Nicole Macri and State Senator Emily Alvarado. They've been doing calls for, about a month or two now. I honestly losing time with this issue. And the state they're going to have to step in. Like as a city, we can't do it all. But there is a really incredible group of people working really hard on trying to fix this and trying to do it as nimbly as we can. So my ask of everyone here is to continue that advocacy, both at the county, at the state level. Allison will explain a little bit more of what's going on at the county, but my kind of bird's eye view into what is going on at the legislature is I think members are going to need a lot of education around what this actually is and what the impact is going to be. And that is going to be huge. I don't think folks fully realize that the roof is about to cave inside of the house that they're standing in. So as you go down to Olympia, really having those conversations and trying to be as kind of clear and concise with it as possible. Because even just the work that we've been doing on the council, like my council member very much understands this and is a subject expert coming out of homelessness services. It's taken a lot of conversations to fully kind of build this out. And with that regard, we were aware that this could be a possible issue as far back as it was April or March, when we had one of the federal select committees at the city council in which we invited our homelessness system partners to come speak on it. So we've kept an eye on this, and it's gotten terrible. So we are working on it. That's really all I have. I'm happy to take questions or anything. It's been very tenuous. I don't want to be Pollyanna and say we're going to fix everything, but we're working our damnedest to do that.
No, thank you so much, Rachel. I think what you have shared is really important, and really partly we wanted you to be able to come here. We understand Councilmember Rink is actually on the dais right now and you're representing on her behalf, but we want to also, it's a value of this coalition. We advocate hard, And we thank folks publicly when we have the opportunity to do so. So the other reason we wanted you here is for you to hear appreciation and thanks from our members. So I'll invite people to come on camera if they can, or, use their emojis, put something in the chat. We just really want to express and appreciate our profound appreciation. It is true that I believe without the leadership of people like Councilmember Rink, Councilmember Mosqueda, and Councilmember Barron, who come from the services, healthcare, advocacy, and immigration justice worlds in public office, we would not be where we are. And I don't believe that there is another community in our nation that has responded as quickly to this threat, although there should be, because we knew it was coming. But I am incredibly proud, even though we understand it is not sufficient. It is a beginning, but it is a powerful statement that this community is not going to allow people to lose their homes, and we're not going to allow the destruction of what we have built together. And the leadership that you and your colleagues and Councilmember Rink and her colleagues have shown, it's profoundly important in this moment. So thank you.
Thank you. I appreciate that. And I'll definitely pass it along to the council
I
member.
know you will. Thank you. And what you said about the state is also true. So let me just quickly cover the county and remind everyone, December 11th, 1 week earlier than usual, is our state legislative preview. And you better believe we're going to have four state lawmakers on the call, one of whom will be Representative Macri. And we are going to be prepping everyone for how we are engaging in the kind of conversations that you all are going to be part of, having to educate your state lawmakers so that they can join in addressing this issue. We're not going to give up. So thank you so much, Rachel. You are, of course, most welcome to stay. And of course, you are welcome anytime. And we'll get the council members perhaps to join us at a future meeting.
I'm going to jump off. I got to run down to City Hall, but thank you all so much.
I figure. Thank you very, very much. So at the county level, we have a real commitment. It was unanimous in the end, but it wasn't looking that way beforehand. So I want to thank Councilmember Barron, who is part of the budget leadership team, and Councilmember Teresa Mosqueda and their respective staff members, whom many of you know, for working hard along with us, along with others. Many of you helped send, I don't know, Hallie's out of the country. I think we sent over 2,000 letters. Yeah. Danielle and Kevin, feel free to jump in. But yes, I think it's over 2,000 messages were sent, which is really part of why we got to where we are, which is that early in 2026, incoming King County Executive, Girmay Zahilai, will now be asked to send an appropriations bill and to look at 3 specific sources of funding to contribute the county's portion to a contingency fund as well. I don't want to take a whole lot more time on this. What I want to say is we held basically an emergency briefing for coalition member executive directors and senior leaders on Monday. We invited our partners from the Washington Low Income Housing Alliance and Puget Sound Regional Council and others to join us. We've got another meeting coming up tomorrow. Our job as convener and information sharer and advocate continues, and you all are huge parts of that. I think without going into too much more, what I want to say is, yes, this is moving quickly. The application is now out, and our community's response is due January 14th. And you will be hearing from us as this is a complex, multiplayer process. And there may be ways that we will be asking people to work on a couple of levels at once. It's very important for our community to put together the strongest possible application under the federal instructions that have been given. However, it is also very likely, as you just heard Rachel allude to, that some of those instructions will essentially preclude our community from being able to do the good work that we know is effective and that we need to continue. So stay tuned. Really, please put December 11th on your calendars. Megan, Danielle, Kevin, if one of you could drop the December 11th legislative preview sign up in the chat. I'm going to sign off now because I know we only have 5 minutes left and really important things to come. I'll stay on. I'll try to answer questions in the chat. You know how to reach us. We will stay in touch with you. This isn't over by a long shot. We also have a national advocacy action to take. And I'm going to put that in the chat, or somebody else will as well. And it is very poignant to me that the National Alliance to End Homelessness is sending an action alert to us, the subject line of which is "Tell Congress to stop HUD." Just let that sink in for a minute. That's where we are. This is part of our active resistance and how we protect our community and show up for the people in these homes, for the people who do this work, and for our neighbors. This affects all of us, but it affects some more profoundly than others. So thank you guys very, very much. And I'm handing it back to Kevin.
Yes, of course. Thank you, Allison. I know that was a lot of information for folks, but it's just so great to hear directly from you, and um, also from Council Member Rink's office as well. And so, yes, a couple things. We only have a few minutes left, so I want to make sure that we touch on our member announcements. And if folks in the audience do, one more thing, Allison, go ahead.
I'm so sorry. And Danielle just reminded me of this. I'm sorry, you guys. My head is really elsewhere. We need to thank all the council members, and there is a thank you action, and Danielle is going to put it in the chat. Thank you.
Yes, so everyone, please, we have a lot of links in the chat in these final minutes. Go ahead and make sure you open some of those up and bookmark them if you can't look at them now for later. Like I was mentioning with member announcements, if we have anybody who's been really waiting to the end, go ahead and raise your hand if you'd like to share an announcement. In terms of our community announcement, we know that Real Change has some changes, and they're hiring for an executive director. We also know there's a number of Thanksgiving and holiday community meals. I'm looking around right now to see if anybody is raising their hand for community announcements. I don't. It's tricky with Zoom because sometimes there's multiple screens. I don't see it right now. In the final moments here, we'll take a little bit and just kind of cover some of the election results. As you all know, we had an election. Megan, if you are able to come off mute and share with us some of the details of our voter registration efforts, go ahead and just hop on the mic when you have that ready. Of course, we are welcoming a newly elected mayor, Katie Wilson. That'll be in January of 2026. The newly elected council chair, Gurmay Zahalai, will actually be starting in a few days here on November 25th. And of course, we know that Alexis Mercedes Rink also has won her election and will be keeping her seat. We're also welcoming a number of folks: Diane Foster, Eddie Lynn, and then of course a new city attorney, Erica Evans. Multiple people reelected to local and city councils and state legislative seats. I know this is a quick recap. Megan, are you ready to read off some information about our voter rights education and registration campaign?
Of course. So within our voter rights and registration education campaign, we have a fantastic group of volunteers, and we were able to have 49 events where we were out in the community at different locations, registering people and providing voter education. Of these 49 events, they were spread out at 26 different locations throughout all of King County. We registered 112 people to vote, and we engaged in some form of voter education, answering questions, providing voting locations with 596 people. So, pretty awesome.
So as you've heard, we make our announcements throughout the election season. We host a number of these events. We love to partner with our members and also our community partners. So hopefully we can be hosting and doing some voter rights education and registration with your organization soon. Anything else from our staff? Allison, I saw you came back on camera before we say goodbye here.
No, those are wonderful high points, and I really want to take a moment. Megan has been a short time staff person with the coalition, doing a lot in a short amount of time, including being an invaluable part of our voting rights volunteer training, orientation, herding, shepherding, supporting, and doing. And as well as a lot of indescribable numbers of other things that she has done in her months with us. It was always going to be a temporary position, but boy, have we appreciated you, Megan, and I really want to thank you. Thanks.
Thank you, Allison, and thank you all for joining us today. You guys hung in there. It was a ton of information, and so many of you are still with us. We will see you on December 11th for our legislative preview. Please mark your calendars. The links are in the chat. And again, we'll be sending out the slide decks from our presentations today. So thank you all. We'll see you soon.
Thank you.